Have you ever stood up from bed and suddenly the entire room started spinning? Or maybe you rolled over in the middle of the night and felt like you were on a carnival ride you never asked to be on? If you've experienced that terrifying sensation where the world won't stop moving even though you're standing perfectly still, you might be dealing with the most common cause of dizziness in adults over 50. And here's what almost nobody tells you. This condition, which affects millions of people every year, isn't usually caused by an ear infection or a neurological problem. It's caused by tiny particles that have broken loose inside your inner ear and are now floating around where they shouldn't be. The good news? There's a simple way to test if you have it right at home, and an even simpler treatment that works for most people in just a few sessions. No medications, no surgery, just specific head movements. But here's the part that shocked me most. Recent research has uncovered a nutritional deficiency that makes you 23 times more likely to develop this condition. And once you fix that deficiency, your risk drops dramatically. Stay with me. By the end of this video, you'll know exactly how to identify this problem and what to do about it starting today. Let me paint a picture you might recognize. You wake up in the morning, swing your legs out of bed, and suddenly you feel like you're falling sideways even though you're sitting still. The room spins. You grab the nightstand. Your stomach turns. Or maybe you're lying in bed reading. You turn your head to check the clock and boom, the ceiling starts rotating. It's not constant. It comes and goes. It's triggered by specific head positions. And it can be so intense that you feel nauseous, anxious, and completely off balance. This isn't just getting older. This is a specific mechanical problem called BPPV, which stands for Benign Paroxysmal Positional Vertigo. Benign means it's not dangerous. Paroxysmal means it comes in sudden episodes. Positional means it's triggered by head movement. And vertigo means that spinning sensation. And here's the frustrating part. Most people suffer with this for weeks or even months before they figure out what it is because it doesn't feel like a typical ear infection or sinus issue. It feels neurological, like something serious is going wrong. But in most cases, it's completely fixable. So what's actually happening inside your ear? Inside your inner ear, you have 3 tiny semicircular canals filled with fluid. These canals are lined with microscopic hair-like sensors that detect movement and help you maintain balance. Normally, there are also small calcium carbonate crystals called otoconia that sit in a specific part of your inner ear. They're supposed to stay put, but sometimes, especially as we age, these crystals break loose. They detach and start floating around in those fluid-filled canals where they don't belong. When you move your head, these loose crystals tumble around and bump into those delicate hair sensors, sending false signals to your brain that you're spinning or falling when you're actually perfectly still. That's the vertigo. Your brain is receiving conflicting information. Your eyes say you're stationary, but your inner ear is screaming that you're in motion. Now, why do these crystals break loose in the first place? That's where the research gets really interesting, and we'll talk about that in a minute. But first, let's figure out if you actually have this condition. The good news is there's a simple at-home test you can do to figure out if BPPV is what you're dealing with and which side it's affecting. And once you know that, there's a series of head and body positions called the Epley maneuver that can literally guide those loose crystals out of the canals and back to where they belong. It sounds almost too simple to work, but the success rate is incredibly high. Studies show that 70 to 90% of people experience significant relief after just 1 or 2 treatments. But before we do any of this, I need to give you an important disclaimer. If you have neck problems, cervical spine issues, or any condition that limits your ability to move your head freely, check with your doctor before trying these maneuvers. Safety first, always. Okay, let's get into it. Step 1. The head turn lying test, modified Dix-Hallpike. This test will tell you if you have BPPV and which ear is affected. Here's what you'll need: your bed or a firm couch and 1 or 2 pillows. Sit on the edge of your bed with your legs extended in front of you. Place a pillow behind you, positioned so that when you lie back, it will support your upper back and shoulders, allowing your head to tilt back slightly below the level of the bed. Now turn your head 45 degrees to the right. Keep it turned in that direction. Quickly lie back onto the pillow so your head tilts back and hangs slightly over the edge. Keep your eyes open and focus on a fixed point. Stay in this position for 30 to 60 seconds. Here's what to watch for. If you have BPPV, you'll feel that spinning sensation within a few seconds. You might also notice your eyes start to make rapid, jerky movements. That's called nystagmus, and it's a telltale sign. If you don't feel anything great, sit back up slowly, wait a minute, then repeat the test with your head turned 45 degrees to the left. Whichever side triggers the vertigo and the eye movements, that's the affected ear. If you have someone with you, ask them to watch your eyes closely during the test. The eye movements are a key diagnostic clue. Step 2. The Epley maneuver, the treatment. Once you know which side is affected, we're going to use a specific sequence of positions to move that loose crystal out of the canal. Let's say your right ear is the problem. Here's the exact sequence. Position 1. Sit on your bed. Turn your head 45 degrees to the right, the affected side. Now lie back quickly with your head extended back over a pillow, just like you did in the test. Hold this position for 60 seconds. You might feel dizzy. That's normal. Breathe slowly and wait it out. Position 2. Keep your head tilted back, but now rotate it 45 degrees to the left, the opposite direction. Hold for 60 seconds. The crystal is starting to move through the canal. Position 3. Roll your entire body onto your left side, the unaffected side, while keeping your head rotated. You should now be lying on your left shoulder, looking down toward the floor at a 45-degree angle. Hold for 30 seconds. Position 4. Slowly sit up, bringing your head back to center as you rise. Sit still for a minute. The goal of this sequence is to guide that loose crystal through the canal and into a part of the ear where it won't cause problems. You should only do this maneuver once per day. If symptoms persist, repeat it daily until they resolve. Most people feel significant improvement within 3 to 5 days. Now let's talk about why this happens in the first place. Multiple research studies, including a major review published in 2020, found a striking connection between BPPV and vitamin D deficiency. In one study, people with BPPV were twice as likely to be deficient in vitamin D compared to those without it. In another study, the risk was 5.5 times higher. And in yet another study, people deficient in vitamin D were 23 times more likely to develop BPPV, 23 times. Why? Because vitamin D plays a critical role in calcium metabolism. It helps your body absorb calcium properly and transport it where it needs to go. When you're deficient in vitamin D, calcium doesn't get absorbed efficiently. It can accumulate in places it shouldn't, like those inner ear structures, and it's more likely to break loose and cause problems. But here's something important. Some people have normal vitamin D levels in their blood, but still have tissue-level deficiency because of genetic variations in their vitamin D receptors. The vitamin is in the bloodstream, but it's not getting into the cells where it's needed. That's why simply checking your blood levels doesn't always tell the whole story. So here's what I recommend if you're dealing with BPPV or want to prevent it. Instead of taking a daily dose of vitamin D, try a weekly loading dose. Both vitamin D and its partner nutrient, vitamin K2, are fat-soluble, meaning your body stores them and releases them slowly over time. Here's the protocol. Once a week, take 50,000 IUS of vitamin D3 along with 500 micrograms of vitamin K2. Why vitamin K2? Because it helps direct calcium out of soft tissues and into your bones where it belongs. It's the perfect partner for vitamin D. The ratio to remember: for every 10,000 IUs of D3, you want 100 micrograms of K2. So if you're taking 50,000 IUs of D3, you need 500 micrograms of K2. Take this dose once weekly. Research shows that intermittent higher dose vitamin D supplementation can sometimes be more effective than daily dosing, especially for people with receptor issues. Continue this protocol for at least 8 to 12 weeks, then reassess your symptoms. A few important safety reminders. If you're on blood thinners, talk to your doctor before taking vitamin K2, as it can affect clotting. If you have kidney disease, high doses of vitamin D may not be appropriate. And if your vertigo is severe, persistent, or accompanied by hearing loss, vision changes, or neurological symptoms, see a doctor immediately. BPPV is common, but it's not the only cause of dizziness. The combination of the Epley maneuver and correcting your vitamin D deficiency gives you a powerful 1-2 punch against this condition. Most people see dramatic improvement within days to weeks. So here's your action plan. 1. Test yourself using the head-turn lying test to see if you have BPPV and which side is affected. 2. If positive, perform the Epley maneuver once daily until symptoms resolve. 3. Start the weekly vitamin D3 and K2 protocol to address the root cause. Come back in a week or two and let me know in the comments how you're doing. Did the Epley maneuver work for you? Are you feeling more stable and confident? I read every comment, and your feedback helps me create better content for this community. And if you found this helpful, share it with someone who struggles with dizziness or vertigo. This information could change their life. Thanks for watching. Take care of yourself.